Hello, everyone. Good evening. Thank you for being here. Really, really lovely to see you all. Um, we are just wait. I can see computers whirring, so we've got a few more people joining us, but I'm going to get going. Really appreciate you being here on time this evening, so thank you. So this evening's talk is around autism, suicide risk, and intervention. And we are absolutely honoured to be able to have Lisa Morgan join with us this evening. Now, just some basic housekeeping before we go, and a little bit of information about Ollie. You may have been on some of our talks before, but we're going to go through it anyway. You have a panel of icons either at the top or the bottom of your screen. You can mute yourself, and actually, we appreciate if you stay on mute throughout the session. Two reasons: it gives a better quality of call for everybody. Also, you would be surprised what we hear in the background, so it gives you some privacy as well. What next? You can have your video on or you can turn it off. We love to see your faces, but equally, if that's not convenient for you right now, that's absolutely fine. You don't have to have your video on. Now, we are so grateful for Lisa and donating her time this evening, but we know within this room there is a huge amount of knowledge, professional and lived experience, and both. We absolutely invite you to populate the chat with, one, your questions, definitely your comments and observations, but also any support, any networks, any books, any papers that you've read, anything that you think is useful, relevant to what Lisa is talking about. What else to tell you? Let me see. Right, this little button here that says CC, if it's useful for you to read as well as listen to what is being said, please activate those captions by pressing that button. It won't affect anyone else, but you'll be able to read what we're saying. Hopefully AI picks it all up correctly. And I want to introduce you to my amazing colleague, Joe. Will you give us a wave, Joe, so everyone can see you? Brilliant. Thank you, Joe. If you have any problems, if your Wi-Fi dips out, Joe will be monitoring and letting you back in the room. Joe is also here if you want to send a message in the chat directly to Joe. Maybe you don't want to put the message in the chat, but you'd like us to ask Lisa your message later, you can do that. Also, if you have to leave the session early, it'd be great if you can let us know. And if you want to do that privately, you can send a message to Joe. For those that are not aware, the Ollie Foundation was set up by the three people you see on the screen next to me. Stuart, Jane and Chris had each lost a son to suicide. And when they met, they decided to do whatever they could to support other families, to ensure that no one had to go through what they were going through and continue to go through. And that's how the Ollie Foundation came to be. Today, we run a number of events and training. We deliver talks and training from little people, actually, with our Planting the Seed for primary age children, all the way through to working with health professionals and everybody in between. We run panel events like the one we're doing this evening, always putting a spotlight on a community where there is risk and looking at protective and risk factors. We collaborate and partner with people around the world. We signpost people to the support and the help they need. And we also share best practice. And we're very proud to say that we contribute to that best practice too. We do all this because as our name suggests, one life lost is enough. Now, I should also mention that we are recording the session this evening, and the intention is that in the next week or two, that will be added to our YouTube library. So if you want to revisit this talk, or if you think somebody you know should see it, they will be able to do so. What we don't do is send the talk, the slide deck. Well, there is no slide deck, but we don't send the talk out. You'll find it on our YouTube library. You've probably been on our website before because that's how you got to book onto this session. If you want to see any of our other work, you can do so by clicking on to the website, you can see what we've got coming up. These are some of the things we've got coming up the rest of this month. Actually, there are 2 more events that aren't on there. So tomorrow morning, if you're in the right time zone, 9:30, we have our online mindful Pilates session. This is great if you can't get out of the house. They're free, so finance isn't a barrier, and you take it as gently as you want. Even if you just do the warm up and leave after that, that's fine. But a bit of movement is so good for the soul. And then you can see we've got our online art class. It's called Zentangle. The next one is on the 18th and then on the 20th. So those are some of the things we've got coming up. January the 3rd, we have our famous goal setting session for the new year. So if that's of interest, please book on to that. We also have lots of resources online that are free for you, resources for professionals, for educators, and for everyone who is possibly taking a medication. Our prescription safe plan is vital, particularly if you're on antipsychotics, antidepressants. But even if you're taking Montelukast for asthma or Accutane for adult acne, there are a number of medications that list suicidal thoughts as a side effect. This prescription safe plan just helps guide you through a little bit of safety feature and what you should do if you think, actually, I'm not doing so well on this medication. Now, let me introduce you to Lisa. Lisa is a licensed clinical social worker and a consultant specialising in crisis support and suicide prevention for autistic people. She's the founder and co-chair of the Autism and Suicide Prevention Work Group and has led the development of several autism-specific resources for communicating and supporting autistic people in crisis. As self-advocate with a passion for strength-based solutions, Lisa has authored several books, and we've got them listed here on the screen. And she's a community council member for the autistic adults and other stakeholders engaged together, a group of autistic adults informing autism research priorities. Lisa is also a consultant and team co-lead on several research projects awarded by the Patient-Centered Outcomes Research Institute. And she runs her own consultancy firm, Lisa Morgan Consulting. This provides individualized trauma-informed workshops for professionals, psychologists, therapists, social workers, schools, for everybody who needs them. So Lisa, thank you so much for being here. I'm going to stop sharing these slides, and now let me see, because we need to pin ourselves so everyone can see us. Spotlight for everyone, and then where's Lisa? Let's do that. Add spotlight. There we go. Amazing. Thank you so much. Lisa, did I miss anything out? Is there anything else people should know about you before we get into this?
No, that was amazing. Thank you.
Well, as I said, I am so grateful for you being here today. I'm just faffing about everybody on my phone to make sure I've got all the questions that I need for this evening. Great, I found them all, so that's perfect. Thank you. So one of the things we thought about all the questions that we'd like to address this evening, Lisa. And I think let's just start with the big one. What is the least understood thing about supporting autistic suicidal teens from your perspective? What are we missing?
Well, I would have to say it is that, and this goes across the lifespan actually, um, the crisis can be experienced on the inside. So an autistic teen can be in full suicidal crisis and look calm and fine on the outside. A lot of times what happens is they're not believed, because even if they can say they are suicidal or they are thinking about killing themselves, they can say it looking just like I do right now, just calm and fine. Everything can be happening internally. So I think that's really the biggest misunderstanding for people who support autistic people, because they believe the outward behavior. They don't look distressed. They don't look emotional at all. And they don't understand that everything can be happening internally.
Lisa, can I ask you, has that been your experience?
Yes. Yes. Before I even, really knew what was happening, Um, I yeah, people were, not understanding that I was in crisis myself. I'm coming up on 10 years. It will be in December that I attempted to take my life. Um, and I was perfectly acting fine and doing the work I needed to do. Nobody knew I was in crisis.
So when you did, well, did you reach out? Were you in that situation where you spoke to people, but you appeared very calm and maybe you weren't taken, it wasn't taken seriously?
Yes, I reached out to my sister-in-law, who did not take me seriously. Um, Thankfully, I was also friends with a suicidologist, so somebody who's very well understands suicide and some of the behavior I was doing as far as not making it to meetings or, isolating myself. She recognized those
Right.
and was a support for me.
Okay.
Um, so I was thankful there, but there are many people who don't have people in their lives who understand suicide in that way.
Oh, Lisa, thank you so much for underlining that. In our talk safe, it's two of the things that we underline. Who's not showing up? Who's not there when they should be?
Mm,
You know, if this is a meeting or a book group or whatever it might be, whether it's social or professional, and they are normally there and they're not, that's an invitation to get curious, isn't it?
yes, it
Mm.
is. It is, even if they're not showing outward signs of behavior, especially
Yeah.
if they're on the spectrum. Yeah.
The other question I wanted to ask you was in relation to maybe not being seen or heard, even though it was all going on underneath.
Mhm.
Can you describe to us how that felt to you? If you felt, if you're experiencing thoughts and perhaps thinking that, or asking people for help and they're not responding, how does that feel?
Well, there were a couple things going on. First, it feels like there's a hurricane or a few tornadoes happening on the inside. I mean, it's wild in there. Which is why, I think I was missing meetings and just isolating myself just to try to regulate.
Mm.
Um, Another thing was because people didn't believe me, I started doubting myself if I was truly in crisis or not. And thought I was just having a hard time or, something else was going on. I didn't recognize I was suicidal right at first.
Okay, that's so interesting. So, one of the things we discussed, Lisa, before was talking about communication and assessment. And I suppose the next step then is we've somebody's been recognized as
Mhm.
struggling with suicidal thoughts. Um, Talk us through communication and where it goes wrong and where it goes right, and particularly thinking for the suicidal teenager.
Right. So autistic people tend to think very literally. Um, and if somebody is in crisis, they really need as few words as possible, getting straight to the point, being bluntly honest is kind and supportive. So if you say, ask an autistic teen if they are um, planning on killing themselves, um, they may say no because they don't have a plan.
Right.
Say, are you going to kill yourself today? They may say no because they do have a plan and it's tomorrow. So, you have to ask exactly what you want the answer to. And a lot of non-autistic people who are in the health professions and who are supporting autistic people tend to speak in a nuanced way. Um, they tend to ask questions that are not literal. And autistic people who, because they think literally, they also listen literally. And so they hear the question differently than what's being asked.
Yeah. Yeah. Thank you again for underlining this point. Something we try and share. Don't use euphemisms.
Mhm.
Be direct. If you want a clear answer, you have to use clear language. Thank you so much. So, when it comes, obviously, you're US based.
Yes.
And most of our delegates this evening will be in the UK.
Mhm.
Um, but keeping that to sort of one side, everybody. When it comes to assessments, I'm sure you've given lots of advice to different organisations. Um, we've already heard language has to be direct.
Yeah.
Um, is there anything, are there any other ways that assessments can be really problematic for the autistic person, particularly the autistic teen?
Um, well, if the autistic teen is in enough of a crisis, a lot of autistic people can lose the ability to verbally communicate when they once typically can. They can lose the ability to verbally communicate. So that happened to me once, and I was in crisis, and the only thing I could say was, I have no words. And so the person supporting me said, okay, well, we'll talk another time. And
Right.
just completely didn't understand what I was trying to say. Um, so that can happen. And a misunderstanding can happen where they don't have words, or for teens, you know, people, professionals can think that they're just being uncooperative, don't want to talk. If they say, I don't know, that's a typical answer for a teen anyway. I don't know about the UK, but in the US,
Yeah, for sure.
I don't know is pretty typical. And they may not know. And that's another thing, is they may have alexithymia, which is the inability to understand or describe one's own emotions. So a lot of people ask, how are you feeling? And I say, don't ask them that, because they may not know how they're feeling. Research has shown that 50% of autistic people have alexithymia, so they may not know. Um, so I typically suggest asking, what are you thinking right now? And that can usually come out and say how they're feeling. You can surely gauge about what they're thinking about. Another way I try to help autistic people who don't know how they're feeling is to sort of hook it on a previous experience. So if it's a really young child or even an early teen, they might feel like they did when they had a birthday party and no one came. More of an adult, or an older teen, they might feel the way they did when they got fired from a job that they really enjoyed. And so if you can understand that, okay, that they must have felt discouraged or depressed or, rejected, you can come up with some different emotions by hooking how they're feeling now to a previous experience.
That's such a good tip. Thank you. And I'm sure it's the same over in America. We are so focused on feelings. How are you feeling? Ask people how they're doing, and for good reason. But we mustn't lose sight, as you say, of alexithymia and the inability to communicate that. Um, Pam is putting. I can see, Pam, that you've put in the chat that what works for you is using WhatsApp. Um, so thank you for sharing that. Um, my child feels more comfortable communicating with me on WhatsApp than face to face. I think we can probably relate to that, right? Sometimes that's so much easier. I'm glad that works for you.
And I also do suggest, and I use this myself for people who support me, is to have a pre-designated emoji that means a certain thing. So you can have an emoji that means I'm in a serious crisis right now. You can have one that I'm having suicidal thoughts. You can designate as many emojis that mean, as many things as you need to for the person you're supporting. And that's so helpful when in crisis and you're just so dysregulated and have so many emotions running inside. You can easily send an emoji.
That's brilliant. And do you know what? I'm thinking now, maybe this is where we heard it from you last time, because we now we now promote to parents and young people going off to university, particularly, you're busy, you might not have time for things. So use the emoji technique.
Yeah.
Choose one for I'm great, sorry, I haven't spoken in weeks. Don't worry.
Right. Yeah.
Please don't panic. And another one for come and get me now, and a few for in between.
Yeah.
um, but it's so much easier, isn't it? That's such a brilliant technique. Thank you. I am just going to pause for a second and just come to the audience, and just to say, as we go along, if you have any messages, any questions, because we're going to go through a lot of stuff. So if anything feels relevant, please feel free to unmute yourself or put your hand up. But equally, you can pop your questions in the chat to Lisa as we go along, and we can take them either as we go along or at the end. So just a quick note about that. I think Chandra has already put in here warning signs. What are the risk factors? So I'm thinking, I don't know if you want to expand on that, but I'm thinking that might be related to when we were speaking a moment ago, Lisa, around it can be very quiet on the outside and the storm is raging in. So
Yeah.
you spoke about not showing up.
Mhm.
Um, you've spoken about some of the other things that we might see, which is the inability to express it. I have no words right now because it's all going on in here, and not misunderstanding that for a euphemism for I don't want to talk right now. Um, Anything else that you want to talk about in terms of those signs that people might notice but misunderstand?
Yeah, so I put an international team together in 2020 and we worked until 2021, including Sarah Cassidy and Mirabelle Pelton from the UK. And we put together warning signs of suicide for autistic people. And so it does, it's really based on an increase or decrease of behavior from baseline. And so it does include no words to communicate, distress. It includes sudden or increased withdrawal, um, suicide as a special interest, hopelessness, increased anxiety, increased self-harm. So it's really a change. There's 10 warning signs of suicide in that resource. It's on my website, along with scenarios that go with it to explain what that warning sign might look like in real life, the research behind each one. We didn't put anything in the resource that was not based in research. So we have those scenarios, sometimes one or two at the same time, for one, particular warning sign. So I can't remember all 10 off the top of my head right now, but they're all, it's a free downloadable resource from my website. So,
Thank you. And maybe Joe, while we're going along, you could find that and pop a link to it in the chat for everybody. And it sounds, some of the ones you've mentioned are, of course, actually some of the warning signs we would see in anyone, regardless of whether they're neurotypical or not. So, is and some of the things you've mentioned already, not turning up to things, that's something we would say is a warning sign for anybody.
right. But the warning signs of suicide for the general population here in the United States, we took one off the American Association of Suicidology's website. And we also have a resource explaining considerations to take when using the warning signs of suicide for the general population, because they contain aspects of autism like withdrawing. So autistic people withdraw for self-care. That's why the other resource shows an increase or from baseline,
From
because
baseline. Got it.
the general warning signs, say withdrawing is a sign. So a professional may not understand that it's not just withdrawing, it's a change from baseline, because someone may withdraw a certain period of time every day, to
Sure.
regulate from work or school or a social event, but it's really an increase from their baseline. And that's why the warning signs of suicide for autistic people are more geared towards autistic people. Also, the general population, the warning signs for the general population have anxiety, which most autistic people have anxiety. So again, it would be a change from baseline.
Right.
And there are
Thank you. Clarifying.
feeling trapped. An autistic person can say they feel trapped in having this autism diagnosis in today's society, and someone could mistake that as a warning sign of suicide. So yeah, this kind of
I'm making copious notes here. I bet everybody else is too. Thank you. Well, when we're thinking, and again, we're focusing today on teenagers particularly, but you know, everybody, anyone who's at risk. But if we're thinking about teenagers, what, in your opinion, makes the autistic teen more susceptible than their peers? What creates a greater suicidal risk?
Well, perceived burdensomeness, like needing accommodations in school, not being able to keep up in a conversation. A lot of times, autistic people, especially if they have anxiety, have slow processing, which does not mean they think slow. What it means is they're thinking of so many things at once that it takes a while to get out an answer or a comment into a conversation. So the conversation goes by, and um, they're no longer, on that topic. And so they're kind of feeling behind. They get, in school, it's difficult sensory environment. It's difficult in keeping up with assignments. They need accommodations. So there's a perceived burdensomeness, disorder belonging in that social communication differences, not understanding, the slang that the other teens that are using these days. So that, that makes them at a higher risk than their peers that are non-autistic.
Thank you. Shelley has put in the chat, Lisa. Shelley says, I've always explained that when you've met a person with autism, you've met that one person with autism
Yes.
and their autistic traits. It's a heightened version of understanding anyone's personality, but you've only met that one person.
Yes, my friend, Dr. Stephen Shore, coined that phrase. When you've met one autistic person, you've met one autistic person. And a lot of professionals don't understand that when they're supporting autistic people either. They think if they find something that works for one autistic person, it's going to work for their other clients too. But you have to individualize any kind of intervention or safety plan or anything that works for one autistic person doesn't mean it's going to work for another one. It could, but you can't count on that really.
So when we're thinking about schools, which is where most of our young people are most of the time, what's some of the great practice you've seen? And maybe you could also share with us some of the things that just don't help and you would like schools to know that's not useful.
Well, I was a teacher before my husband died by suicide, and I got into advocating. Um, and so what I suggest is really modeling what you want the other students to do. So in school, I'm trying to find my notes here. Well, I can just talk. So you want to model accepting differences. You want to celebrate differences. Even in my classrooms, I had one student who really needed humor in order to feel, belonging in the class. And I allowed that humor because it helped him to belong. Making accommodations seem, not like everyone can use accommodations. So not like spotlighting them for autistic people, but have them be part of the classroom. Anything that benefits an autistic student is going to benefit the whole classroom. Also sensory issues, have it be sensory friendly, which can also benefit everybody in the classroom. Have everybody talk about how different they are. Two of my sons are Asian. I adopted them, and we've gone through the same kind of thing that I experienced in class just from them being different. They're not autistic, but they're different looking and from the majority of the students in their classrooms. And it's just, making the classroom, making the school a place where, differences are accepted. Everyone can have accommodations. Everyone can have something that helps them better than something else, and just kind of normalizing instead of being different, normalizing differences. It would go so far in helping autistic people feel connected and not feel like they're a burden, and that they do belong.
We had a question, and I'm sorry if we've jumped around, because we also had a question around intersectionality and diversity, and maybe it's a good time to speak to that now. And before we do, also, Lisa, can I just say along with everyone here, can I send my deepest condolences around the loss of your husband? And I wonder if you want to tell us anything about him, if you want to, if we can know his name, or if there's anything you'd like to talk about, or whether we move on.
Well, I can say that 3 months before I lost my husband, I lost my nephew, David, and then 3 months later, and it was going to be for my family. There were 3 months between my attempt, my nephew's suicide, and my husband's suicide, and we're all on the spectrum. So for my family, we almost lost 3 people. But I've really focused on the support that I received after when we found my husband. It was 4 days after he actually died, and the first responders were very kind, very helpful, very supportive. And when they were done and they left, I felt completely unsupported and alone. And so that's where my advocacy started, was to, these were kind, helpful, wonderful people that did not support me in a way that I saw or needed as support. And so it's like nobody did anything wrong, but I was traumatized by everything that happened. So, that's what started me on my advocacy work.
And do you
Yes,
work with first responders, Lisa?
I don't get a whole lot of chance to work with first responders themselves. I've done like a TED Talk and I've done other things. I've shared my story many times. But as far as working directly with first responders, I haven't had that opportunity yet.
Well, it's coming up to Christmas. Let's see what we can do to make that come
Okay.
true, because um, we hear from first responders themselves. We did a talk. I mentioned to you, we did a talk recently on child on parent violence, uh,
Right.
and we were delighted, actually, that one of the first emails we got after that talk was from a very large police force in the UK that said, our frontline officers don't know enough about this problem. We don't know enough about this. Please come and train us.
Oh,
And I know that they would love to understand. I can think of a number of first responders who would be so keen to hear from you. So, and anyone on the call who is connected to any first responders, please let us know, because that would be so important. And also, I think crisis line call handlers.
now
Um,
that's where I do a lot of my advocacy work. Yeah.
Okay, so do you want? I know I asked you about another question, but
Personality. Yeah.
do you want to tell us about what you do with crisis line call handlers?
Sure. So when I started what's the Autism and Suicide Prevention Work Group now, I started it in 2017, and the first resource I wrote was directly in response to the night that we found my husband. So it's basically how you can communicate with an autistic person, how you can identify you may have an autistic caller or texter or chat person on the line if they don't either know they're autistic or haven't said that they're autistic, disclose their diagnosis. It talks about how to communicate with them, how they think. It talks about different aspects of autism. It talks about how to support them, be more supportive, and it has a one-page use in real time. Right now, it's been translated for use in Brazil, Portugal, into Spanish, and it looks like it's possibly going to be translated into Danish. So many people are using it. And it really went from crisis center workers in the US to any professional supporting a suicidal autistic person of any age. And then it went to the other countries. So
How can people get hold of it, Lisa?
it's on my website too.
It's
All the
on your
resources
website.
are on my website.
Fantastic. I may have to ask you if we can link to it from our website, because this feels like it's
Oh,
for
sure.
people.
Yes, definitely. We're trying to get like dissemination is kind of the hardest thing after we do a resource, getting it out
Oh,
there. A
that
lot
would
of,
be our pleasure.
yeah, a lot of national suicide prevention organizations in the US don't have autism on their radar as far as needing assistance. And so we have some of our resources on their websites, but yeah, we're looking for any exposure for the resources. They're free and downloadable, like I said, to support any autistic person.
Well, just to remind everybody, whenever we run an event like this, we always create a resource booklet. So everything that Lisa is talking about will come out to you in that resource book in the next few days. And equally, if you pop anything in the chat that is a resource that you have found that's useful, we will add that into that document so everyone can share it. It will also be linked to the YouTube video, so anyone that watches it can get that resource. So Lisa, we can definitely help get that message out. It's so important.
That would be amazing. Thank you.
It's so important. And I wrote down here to ask my crisis line call handlers, how do you identify an autistic caller? How would you do that?
Yeah, well, we talk about in the toolkit, we talk about, are they talking about having difficulty with sensory issues in the environment? Are they talking about not knowing how to, make or keep a friend? Do they talk about a lot of relationships that have gone, you know, not, wrong, I guess, for
Mm.
lack of a better word? So there's different things to look for as far as what they're saying. Are they having a long processing time? Are they talking about being anxious? Different things to look for. Um, and then we talk about how to support them.
Oliver in the chat has written, I found that if I treat everyone in a trauma-informed way, it works well. And that's
Yeah,
great advice, Oliver.
yeah. Because, everything we've developed for autistic people is good for everybody. It's good for everybody to have somebody who's slow down and listens, to use as few words as possible if they're in a crisis, to use direct language, things like that. It helps anyone who's experiencing a suicidal crisis, really.
Thank you. I have noted, and I just want to say, Sazzle, I hope I've said your name correctly. I have noticed that you've said in the chat that you are in a crisis stage and nothing is working to make it better. And maybe we could come to that in the Q&A. But I just wanted you to know that we've seen your notes, so thank you for sharing that with us. So the question that I did ask Lisa, that to come back to again, if you don't mind, how do factors, because you mentioned your adopted sons and just being different in that way, um, um, presented challenges in the classroom. Is there anything you'd like to share with our audience around gender, race, socioeconomic status, and the intersection with autism, and where that creates risk or takes reduces risk in terms of suicide?
Yeah, so there's a lot of autistic people with a lot of intersectionalities. And I guess you have to look at it as, to be autistic, one has to have an autistic brain. MRIs have shown that autistic brains differ from neurotypical brains in function, neurocircuitry, and structure. And then on top of that, they may have a race, they may have identify, with a different gender. They may have a different religion, socioeconomic status. All of those other factors can overlap and cause an autistic teen to experience, thwarted belonging, perceived burdensomeness, isolation, bullying, rejection in so many different ways. So it really causes more, they're at a higher risk of suicide because they're just experiencing it in so many different ways.
Yeah, absolutely. Pam has asked specifically to understand a bit more about any work or any knowledge you have around the trans autistic teen. and suicidal risk. And uh, we we actually say exactly the same as you, Lisa. So thank you so much, because it's like, whew, we're all on the same page. But it's not being autistic. It is the thwarted belongingness. It's the perception of burdenness. It's that lack of connection that is so hard for us, any one of us, to bear. Um, so for Pamela, she wanted to know a little bit more around the trans teen and your experience with that.
Well, I don't have any direct experience with that. Um, I do know that many autistic people do identify as in a different gender than, um, they were assigned at birth. Right now, I can say that the 988, which is the national crisis line in the US, the Autism and Suicide Prevention Work Group, is sending one of our members, who is a trans college student, to advocate for, he'll be the only autistic person there. 988 is having a meeting next week in Maryland. No, it's this week, it's on the 12th. Where they're talking about how to support, these teens of different gender identities when they call, text, or chat into 988. And he has been sent there as sort of an ambassador for the autistic teens of different gender identities. And he's going to be amazing. I know he's very active in trying to get peer mentors to have support these people. So that's happening right now, I can say. But I don't have any direct, support. I do know the risk factors, the unique risk factors. So the risk factors for the general population all affect autistic people as well. But autistic people, research has shown, have unique risk factors as well. And some of those risk factors are, more affecting trans teens and teens that identify with different genders. They're like, unmet support needs is one of them. So they would have a higher number of unmet support needs. Masking and camouflaging is one of them. So they would probably be masking or camouflaging more if they don't want to talk about their gender, or can't, or don't feel like they can. The word of belonging, perceived burdensomeness, we already talked about those. A diagnosis of autism is a risk factor of suicide. Autism burnout, because of all the different intersectionalities they're dealing with, they could have more of a chance of having autism burnout, which is a unique risk factor of suicide for autistic people as well.
It's interesting. Oliver in the chat has said, working with LGBTQ plus youth groups, and has found that a large proportion, if they had more support at home, it and you mentioned, support being so useful, and they flourish when they do. And then straight after that, Pamela has said, but I have a 12-year-old and I receive so much judgment for supporting them, as people feel they're too young. But Pamela's concerned that if they don't support their identity, it may result in really poor mental health, and some of the outcomes we're talking about today. So, but they're only 12. So it's really interesting. You see the different struggles people are having.
Well,
I'm sorry, go on.
there was the Kennedy Krieger Institute did a survey this past April, particularly on children. They surveyed 900 caretakers of autistic children, and the statistics were like 36% of the autistic children were saying they wanted to die, or it was in the 30s again where they had plans to die. And when it got down to the ages, these were ages 8 and younger, some of them. So it seems like autistic kids are experiencing these things, these terrible things, at a very young age.
Oh, absolutely. That age group, not being connected, being left out,
Yeah.
never getting the invitation to a party.
Yeah.
or not having people attend your parties. This matters. Of course, it matters to them. It's heartbreaking.
Yes. And
I-
they know. I
Yeah,
mean, it started for me in first grade. I can remember the experience on the playground where I started being, the one who was bullied and left out and rejected. It was first grade.
yeah. And it's nuts to think that you didn't feel that.
Oh,
It's
I did. Yeah.
yeah, yeah. It's unbelievably painful. How horrible. I'm so sorry that happened to you, Lisa.
Thank you. Thank you.
Mike has asked, he has this conflict responses given to him. So he's been told that it can be harmful to ask those who are autistic if they're thinking about suicide. Um, and I'm wondering, Mike, if some of the people that talk about this, so we have also at Ollie had the experience of having people come on our training and then focus on one area and then focus on certain parts of a sentence, and then we get really, really trapped. And I'm wondering if that's the kind of concern here, but we want Lisa to answer your question. So can
I
you
would
speak to that?
I would say that for autistic people who have difficulty communicating socially with non-autistic people, um, opening the door, so to speak, of a conversation about suicide could be very welcoming if somebody is experiencing suicidal ideation, because they may not know who to talk to. They may not know how to start the conversation. They may not know which things to say and which things not to say. So they don't say anything. But if somebody does start a conversation with them, they have that opening. And I think it could really be helpful for someone. Plus, there's research that shows if you do talk about suicide with somebody, it does not put the idea in their head, which is what a lot of people are worried about. A lot of parents, especially, are worried about, if I talk about suicide, I've just put the idea into my child's head. And
Yeah,
there's research that says that that's not the way it works. It doesn't happen that way. Um, Most likely everybody kind of knows about suicide anyway. And if you really are feeling suicidal as an autistic teen of any age, having that opening to be able to talk about it can be very helpful.
and at the Ollie Foundation, one of the things we do is talk about just holding that space where in this moment both are possible. So not sort of squashing that sense of in this moment I'm thinking that I don't want to be here anymore, that I want to die, um, because there will be reasons for that. So we have always advocated for honouring that in that moment both are possible, that the pain today in this second feels like this, but we always put sort of push the spotlight on hope and pressing pause. Actually, what we advocate for is just pressing pause. Both are possible, and we're not taking either option away from you. But what we want to do is agree that we'll pause today on doing anything. Certainly anything that is irreversible. Would that advice be welcomed, Lisa, by you? Or have we missed anything?
No, yes, especially, and you're the only one that I've ever heard besides me say this. Not that no one else has, but I haven't heard anybody. Um, is that, taking away that idea of possibly, it's really escaping, right? Um, but
Yes,
comes
yes,
across as suicidal ideation. Taking away that idea can make an autistic person who is thinking suicidal thoughts to escalate into action,
yeah,
because now what you've done is you've taken away their escape, even if they're just thinking about it. So, and that's what happened to me with my attempt. Is I was just thinking about, you know, my favorite bottle of wine, my favorite book, going into my garage, turning on my car, just I had the whole thing. I would plan it every time I needed escape. I thought about it. And then I had to at one point leave my marital home for safety for me and my two youngest kids. And I did not have a garage. And I escalated into an attempt, because I no longer had that escape. Um, so I've heard other people too, people that I support say, you know, I have suicidal ideation, but what I really want, I don't want to die. I just want to escape. I can't stay in this state anymore. I can't experience what I'm experiencing anymore. So they'll say, I don't really want to die, but I am suicidal. I have suicidal thoughts. I have suicidal ideation. I live with it. It's a terrible thing to live with. But yeah, it's really about escaping.
And I really can't stress this enough, how important it is to have, it's so respectful for someone to hear that this is possible for you. And it's a conflict right now because you want to escape, but you don't know how else to without ending your life. And that's the conflict. Um, and I think it's so important. So I'm so glad that what we're saying really lines up with what you believe and what
Yeah.
you're saying too. Oliver reminds us that and shares so candidly that at one point he couldn't think beyond the next 5 minutes, but that's okay. He just went from short little moments to the next, and that's what we say too. We're pressing pause for now, and then we press it again, and then we press it again. At Ollie, we often talk about suicidal crisis as a wave that crashes over you. And if you've ever been knocked over by a wave, then you'll know how disorientated you feel and how completely nothing, all you can think about is getting out of the wave, and finding up from down. And the wave might crash back again. A suicidologist that we know, Lisa, will say that intense wave, and Oliver, I don't know if this is something that you can relate to, but that actual intense crisis tends, for most people, most of the time, not to last beyond 3 to 5 hours max because it's just exhausting. It's just physically and emotionally exhausting. So even if it's just someone falls asleep, but that doesn't mean the wave doesn't crash down again. So that pressing that pause and reminding ourselves that we can do that.
Yes, but there's also rumination for autistic people. So
Okay.
rumination can keep that maybe not at the crest of that wave, but the suicidal thoughts right at the forefront of their mind for longer. And yeah, it many trainings do say that the crest of the wave, you know, you have suicidal ideation and it goes up and up, and then the crisis is right at the peak of the wave. And if you can make it through that, it kind of wanes uh
Yeah.
and kind of goes away for a bit. But rumination can make that a different experience for autistic people.
Right. Can you maybe explain a little bit more about that specifically for any professionals on the line? I think we have a few people with lived experience who probably get exactly what you're saying. But for those that haven't experienced that, could you say a bit more on that?
Yeah, so when you're ruminating on something, you can't get it out of your mind. It's like a broken record. And if you do, if you are able to force it out, it usually just ends up as a background task. And so even if you're doing something else, thinking about something else, it's always there. It's like a broken record. So it keeps all of those thoughts, all of the angst, all the suicidal ideation thoughts right in your mind at all times, and you don't get a break. Rumination is very difficult to stop those thoughts and switch them to more positive thoughts. Like it could be a difficult experience you've had. It could be just overall exhaustion for every moment of every day that, you know, is difficult. It could be so many things, but if you're ruminating on it, it's going to be there in your mind and you're going to be thinking about it, and not get a break.
Is there anything in your experience that others can do to support someone who is trapped in that cycle of rumination?
Yeah, I suggest to autistic people to practice not thinking about it, and then when you find yourself thinking about it again, to um stop, you know, really try hard to stop thinking about it again and try to get the space in between father and father and father apart. It takes practice, like anything else would take practice. And so and it could take a long time, but it's worth it in the end. I've gone from, ruminating over one conversation for a couple of weeks to, if I to not ruminating on it very much at all. There are still some things I can't get out of my head, but I use that same practice strategy where you can even time yourself, where I stop doing anything I can, distraction strategies, listening to music, singing, if you have to try to get your mind off of those thoughts because you're busy doing something else, and then see how long it takes where you feel it could be like tension in your shoulders or something. And then you realize, oh, I'm thinking about it again, and then try again to distract and have it be longer. Also, really intense, passions that people have can help to distract those thoughts
Okay.
as well.
There's some really practical stuff. And one of the things we were going to talk about this evening, and we're rapidly running out of time, is the importance of routine and structure.
Mhm.
And I think we've already started thinking about that just now. So what more can you tell us about that in supporting those who are suicidal?
With routine and structure.
Yeah, yes, sorry.
Yes. If you have a safety plan, routine and structure, I say, are strengths for autistic people in using safety plans. Because if they can get into the routine of using their safety plan, when they're in a crisis, it will become sort of automatic. It will be part of their routine and they would use it. Um, Experiencing disruption is difficult because a lot of autistic people plan their day, where they're going, who they're going to see, can they leave early, what are they going to eat, are they going to let, just so many things that we plan for before we step out the door. And if that routine is changed, what we're left with is uncertainty, feeling unsafe, not knowing what to do, heightens our anxiety. So if you're already feeling, dealing with suicidal ideation, living with suicidal ideation, that can increase the suicidal thoughts and behaviors. It's very, very dysregulating.
Thank you. You've put a lot of ideas into my head just then. I have um, a very young person in my family who's just received a diagnosis, and I was just while you were talking, I was thinking about how upset she gets when she leaves or when she arrives, and I was just thinking we could create a visual diary of what's going to happen, so she has it
Mhm.
and she'll know what the structure is going to be.
That's very
We just
helpful.
need everyone else to stick to it.
Yes.
That's the hard bit, I guess. Andrea is saying, what about the autistic teens who are housebound? Andrea, is there something more about that? What's the concern there, or what's the actual question? Or were you hoping Lisa might speak generally about the housebound autistic teen? And while maybe, Andrea, you're thinking about that and you could maybe extend your question, um, Lisa, I wanted to ask you, what advancements or changes have you seen, or what would you recommend? What do you think is ahead of us in a good way for autistic teens in the next few years? What's coming?
Well, I mean, I think one of the big things, because it's one of the easiest ways to get help, is the National Crisis Line or crisis centers. So having it be uh having a dedicated number where they know they're going to get somebody who understands autism or an autistic person themselves, so peer mentoring, and so that it's not harmful, it doesn't cause unintentional harm, it's actually supportive. I would really like to see that, so many people can get the help they need. Right now, there's so many people who will not even call a crisis line or a text line because they haven't intentionally harmed. I'd also love to see at the university level, in majors in curriculum, um, talking about autistic people, not the medical model of deficits and dysfunctions and disorders, but the social model of differences and accepting who autistic people are, so they don't have to mask in order to fit in and have that relationship or have that job or have higher education. Um, for anybody who's going to be working with or supporting autistic people, they need to have how to support autistic people in the curriculum, and it needs to be developed by or with autistic people. If we can, because I really believe masking and camouflaging are a big part of thwarted belonging, unmet support needs of the risk factors. So if autistic people felt that they could be their autistic selves and really get to know people as their autistic selves instead of who they're masking as, that is suicide prevention right there. Is if autistic people can be autistic and still be accepted and still be loved and cared for, even though they are autistic and may look a little different, talk a little different, think a little different. That is suicide prevention.
I am writing that down as quickly as I can. That is just beautiful. Thank you. Thank you for that. I'm seeing the chat fill up very quickly now at this point. So I just want to make sure that we are seeing things that we need to see here. So going back to the question Andrea had, it was around structure in, so for the, do you have any guidance at all? And maybe you don't, but she's asking about, well, what about the teen who won't come out of their bedroom, who's housebound? What would be your guidance around helping them create a structure when they have isolated themselves to the point that their force, their bedroom is their world now?
Right. Yes, I was just supporting a teen very, very, very much like that, giving up on any kind of support, would just be in his room. His video games distracted him. His cat distracted him. That was his world, his cat and his video games. I really think what the teen needed, and the parent, the family did try to do this, was to, be a part of the family more, have family outings where everyone goes, have family activities where everyone participates. Of course they could still refuse, but activities that are very interesting to the person, possibly like somebody said, before, when they communicated with their child through WhatsApp, maybe communicating with them through a digital way. But really they need to have hope. They need to be interested. They need to have their curiosity piqued again. I know it's very difficult. I would try to find out why they've isolated. Was there something that happened? But I do think, the whole family together, doing activities, working around the house, chores, being part of the family in that way as well. Taking meals with the family can help, just trying your best. And every kid's going to be different, be individuals. But yeah, just trying to make their world a little bigger.
And talking about the routine and going back to safe plans actually a little bit. So we have a question that says actually, they're talking about a recently diagnosed autistic teen who just can't talk about it and goes into shutdown. And they're saying that safety plans for them are the activating, the triggering resource because no one else follows them. And the professionals want to do risk assessments, or they put punitive plans in place around, well, if you don't follow this, this is going to happen. So rather than adding and supporting, they're taking away, which this is an anonymous question, and my heart breaks. My heart breaks that anyone is supported by professionals that are so uneducated. I'm just going to say it in this area. That is outrageous. And it is, risk assessments. I've heard some of the leading suicidologists, certainly in this country and probably in the States as well, because I try and follow as many as possible, who will say, with the greatest respect to all the professionals on the call, risk assessments are often not worth the paper they're written on. So if we're looking at them to assess the risk of suicide, um, for I think some of the reasons we've spoken about today, people can seem very calm.
Mhm.
You won't necessarily know. They could be telling you one thing, but the way you have uh, articulated your question, it wasn't clear. So when we say things like, "You're not thinking of doing something stupid, are you?" The response is, "No, I'm not thinking of doing something stupid, but I am thinking of killing myself." They just haven't expanded on that.
Right.
Um, so my heart just breaks for you that the safe plan itself, because other people aren't following it. But the Ollie Foundation has a personal safe plan that you can download. There are lots of safe plans available, but they are personal, and I would argue that actually maybe a new safe plan has to be created, one that considers my safety around the others who aren't considering my safety or who don't understand me. That would be part of your personal safety plan.
Yes, and a lot of the safety plans are based on people, a support network, and that just kind of um, drives home to an autistic person who doesn't have one that they don't have one, that they don't have people to put down on their safety plan. So,
Yes.
I think safety plans do not have to be based on people. There can be safety plans for autistic people where no people are put down. What's put down are coping strategies that work for that person
Yeah.
or distraction strategies that work for that person. And it could be spinning quarters because they enjoy spinning quarters. It could be collecting, you know, anything because they enjoy collecting anything that they are interested in should go on their safety plan. And there could be a lot of white space. There could be reasons for living put down.
Yeah.
And,
Yeah.
the emergency numbers, if they've been harmed by 988, maybe there's somebody else they can call who will distract them for a while. I went from a difficult 988 call that I was texting just the fall of 2023, where I was told I was being combative because I asked for, can we just, not talk for a minute because he was not understanding my needs and I wanted to stay connected to a person because I was having some pretty high suicidal ideation. And so he said I was being combative and he hung up on me. I went from that to a friend who we talked about bubble tea because I hadn't heard of it before. So we talked about bubble tea and someday having bubble tea together. And that was so much better for me than the 988 person who didn't understand me. So, it could be somebody who is helpful and supportive that they can be distracted for a little while with some talking about something other than their suicidal thoughts or talking about their suicidal thoughts. But safety plans, like Debbie said, they can be individualized and just for the person, personalized. Um,
Absolutely. Yeah.
and just reminding them, what can I do right now to distract me?
Yeah. Oh my gosh. I'm sort of welling up here because I remember you talking reminds me of a terrible, terrible time I had. And I had to get on a train and I rang my mum and I had no words. And I just said, just talk. Like, this is a really long train journey and I'm really in a pickle. I'm in a mess. Just can we talk to me about anything? So I so completely relate to that. And it's such great advice. Tash in the chat says Brighton Medical School currently has a great program where medical students are matched with families of autistic children for 1 year to gain lived experience and understanding. So good on Brighton Medical School.
Yeah, that's
Um,
an excellent idea.
yeah. Um, what else? What else? What else? I'm going to ask you guys because I'm trying to keep up with the chat. We are really past the hour now. It's coming up to 9 minutes past. So you can unmute yourself as well if I haven't seen your question and you would like to ask Lisa directly any questions that you have. I'm just going to read this out. Oliver says, I always remember being told who to put on the safety plan and just being confused because they weren't people who I would ever tell I was suicidal. I mean, this is it's one of the reasons we run safe plan sessions to teach people, both professionals and the public, how to use a safe plan well. Why would you put someone down there who you're not connected to? That's
Exactly.
Oliver, that's awful.
Yeah.
Um, One of the things that, oh, thank you so much, Joe. Joe has put a link to our Plan Safe training and also the document that's on our website. I should just quickly mention, if you don't mind, Lisa, on our website, we also have something, this is probably back to front for you, I don't know, but it says My Prescription Safe Plan. This is very different to a safe plan. It's a very different document altogether. But this is to support patients who are on a medication where suicidal thoughts are listed as a side effect. And you would be surprised how many that would include. So we're talking about all antidepressants, all antipsychotics, some antibiotics, Montelukast for asthma, um, Roaccutane for acne. Now, and Lisa, we were talking about crisis lines. We are also trying to work with crisis lines. So imagine the scenario where you have an autistic teen, they have reached out to a crisis line, they have managed to have a supportive conversation, and the whole backstory makes absolute sense why that person today feels in crisis. But the one question that hasn't been asked, or the piece of information that hasn't been offered, is that 2 weeks ago they started Roaccutane for their acne.
Oh.
And actually today, despite the long backstory that makes total sense why they would be feeling like life isn't worth living, or you know, that they need to escape their life. Actually, the truth is it's a medically induced suicide sense of despair. So if you want to know any more about that, you can download it from our website, and it is in 16 languages. Um,
Wow. Nice.
so and after this talk, Lisa, maybe we can chat with you about getting some of your resources into other languages. Maybe we can help with that.
Oh, that's cool too.
Debbie, can
Um,
I just read out one of the anonymous messages, Debbie? I don't think you've read this one out.
yes, and it's definitely one because I've seen some are like, don't read this out.
Okay, but is it okay if I just read this
Yes,
anonymously?
please. Thank you.
So my 10-year-old has just started self-harming. She said she does it because she's angry, but cannot say what she is angry about. How do we find out what is making them angry when they don't actually know or can't express it? I'm trying so much to help prevent her getting to the point where she is suicidal.
So she knows she's angry. That's good. Um, I'm wondering, can she draw it? Can she tell it in a story? Um, can she possibly give directions to the place where she got angry?
I would add, if this would work for her, of course, not and but looking at cause and effect logic. So this often works very well with my autistic delegates and clients. So the top of the page is I'm angry, or whatever the behavior is that has just been expressed, and then an arrow down, what happened before, and then it's just cause and effect logic rather than building up. If I do this, then that. We're taking the final piece of behavior, which is I'm angry and I slammed the door or I shouted at someone. And then, okay, what happened before? And sometimes that can be really helpful in getting a whole backstory that it's just a process that seems to work quite well for people. So I don't know if that would help.
Thank you.
So we have um, certainly 15 more minutes. Um, for those that want to speak with Lisa directly, Lisa, how can people work with you or connect with you? We've put your all your contact details in our resource guide, but do you want to remind people here?
Sure. On my website, there's a page to contact me, and it's just a form. Put in your email, write me a message, send it away, and I get it, and I will respond.
Perfect. Thank you. And for anyone that wanted to continue the conversation around anything the Ollie Foundation might be able to do or have spoken about tonight, well, you've had several emails from Joe, and you can contact us at the Ollie Foundation. Ah, thank you for putting that in there. Thank you, Joe, for that. Lisa, if there was, I'm going to ask you, for parents, what is the one thing you'd like them to know from your experience? Is there a
Well,
message that you would leave them?
if you're concerned about your child, I would definitely keep an open, honest conversation line open. I have had some experience after my husband died. You know, my kids had thoughts of, you know, some of those thoughts and everything, and we had complete, open, honest conversations about how they were feeling, about what could make it better, what they needed for support. You know, what if there was anything they could change, what would it be? Made sure access to means is reduced as much as possible. I know you can't make an environment completely safe, but you can make it a lot safer. You know, and if there's any kind of interest they have that has access to means, such as if they, you know, like to whittle and there's not whittling knives, you know, kind of help them to understand in order to keep themselves safe, give it to a safe person while they're having these high suicidal thoughts, and then they can have it back. And that teaches them skills for when they're alone and independent, if they are going to be independent, or at least, you know, as they get older and make more decisions for themselves. But really being open, honest, bluntly honest, and communicating, following their directions, following, you know, their lead in some of this as well.
Thank you. Thank you. I mean, when I listen to you, Lisa, it's like, it's not that hard. But I know that there will be people on the call thinking, well, it blooming well is for me right now.
It actually is difficult to ask your child, are you having thoughts of harming yourself? Are you having thoughts of, you know, killing yourself? Do you have a plan? But actually, like I said before, that could open the door for a conversation to have, because they're thinking it and they don't have anyone they think they can talk to. And if somebody's safe, you know, opens that door, you know, you can be doing a lot of good in that way. And so but it is hard. It is hard to talk about it. It gets easier. But just being open and honest and direct is what these kids need. Knowing who they can talk to, brainstorming about how, you know, they can help these suicidal thoughts. It's very difficult to live with suicidal ideation. But sharing it with somebody safe, you know, can help. Yeah.
Thank you. Thank you. It seems to me it's always about connection. And as you so rightly reminded us earlier, it doesn't have to be connection with another person. That
No.
connection can be with nature, with your spirituality, with your love of running, whatever it might be, but
And
feeling connected.
yeah, and autistic people actually can be connected to objects, you know, and a color. A color can be very soothing for an autistic person if they can wrap themselves up in their color. That could be enough to feel safe, to, you know, feel comfortable, to feel even supported. So yeah, it doesn't have to be a person.
Thank you. Thank you for reminding us of all of that. My lovely audience, I'm going to hand over to you for these last few moments. Would anyone like to join the conversation? An observation, share anything?